And I'll be your host for this panel. This is actually panel 2, the second panel for the politics of care during COVID-19. And I believe that we have 4 panelists, although one of them is undergoing a medical situation, and she will have to let us know whether or not she is up to presenting. We'll be beginning with Nikhil Pandhi, based at the Princeton University, I believe. And the title of his talk is Chronic and Concentric: Structural Casteism and the Violence of Care in Indian Public Health Praxis.
Thank you, Jan, Anna, Karen, and the other CSAS Executive Committee members for putting together this superbly provocative and timely conference. I'm going to try and share screens. Hopefully you can, okay, sorry. Okay, yeah. Hopefully you can see my screen. And just to clarify, I have about 15 minutes of a presentation. Does that sound all right to you? Okay.
That's perfect. We were saying 15 to 20, so thank you.
So I think that should be perfectly fine then. Okay, so I'm going to go straight into this presentation, which I've called Chronic and Concentric: Structural Casteism and the Violence of Care in Indian Public Health Praxis. My presentation centers around 2 vignettes which highlight how ethnographic methods can force a radical reckoning with myriad forms of structural casteism in Indian public health discourse, design, and praxis. I hope to conclude with some reflections on the value and stakes of ethnography as a method of critically reimagining public health praxis in line with demands for radical humanistic and social justice in India and South Asia. Coming to the first vignette, which I've called Incarcerating Hope. In August 2020, over 600 women gathered in Jantar Mantar, a popular site for protests in the heart of New Delhi, even as the 31 million inhabitants of the city were reeling under a harrowing public health disaster caused by acute shortages of medical oxygen, ventilators, hospital beds, cremation grounds, and burial services amid record mortalities from COVID-19. Defined by India's National Health Mission as accredited social health activists, or ASHAs, these low-income women braved the threat of police brutality, sexist slander by politicians, and not to mention the pandemic itself. Indian health workers taking to the streets is not an unusual sign of protest. Yet, what was unusual about this event was the fact that the protesting ASHAs were calling for a jail bharo. They were literally courting arrest. To be sure, this wasn't merely a symbolic demand. India has a nearly 1 million strong female workforce of ASHAs who labor as frontline health workers in villages, cities, and settlements distant and remote. According to India's National Health Mission 2005, ASHAs are health activists in the community who act as the first port of call to facilitate primary healthcare delivery, create awareness about the social determinants of health, mobilize local health planning, and ensure the well-being of women and children. Why then was this crucial public health workforce possessing key cultural and social expertise protesting to fill the country's jails in an ongoing public health emergency? A long-term interlocutor, Sunita Devi, one of the coordinators of the protesting ASHA workers, said in Hindi, "Asha jail mein band hogi to shayad swasthya vipda kayam karne ki asha jagegi," which translates to, when ASHAs are incarcerated in jail, then perhaps some hope of controlling India's public health catastrophe will arise. Sunita Devi's ironic words were a vital play on the double meaning of the Hindi word asha, which literally means hope. With her acute and astute observation, Sunita Devi was at once articulating the many layers of crisis subsumed within contemporary India's public health catastrophe, of which COVID-19 is only the newest epidemiologically visible form. What is likewise vital to recognize here are the many layers of affective and experiential reckoning built into Sunita Devi's claim. Subaltern calls to fill prisons carry a distinctly anti-colonial force in modern South Asia, derived from exposing the carceral logics of the state by exploding the symbolic site of that incarceration, the prison itself. By willingly giving themselves up to incarceration and by deliberately refusing their public health responsibilities, in my view, the Ashas were also articulating something structurally radical. They were utilizing the blurred contours of catastrophe, or vipada, as Sunita Devi called it, to broaden the ambit of their embodied claims and critique by combining intimate histories of caste humiliation, caste-based violence, injury, debility, and caste terror with more spectacular, if secular, forms of emergency being experienced by the residents of the city. As I mentioned, Sunita Devi's use of the Hindi term vipada, which could mean anything from an affective state of calamity, catastrophe, disaster, emergency, and include more specific structural and symbolic forms of violence and embodiment is key here, for it crystallizes her attempt to introduce an indeterminacy into the very catastrophe itself. To understand the fugitive meanings of Sunita Devi's claim, let me provide more ethnographic context to the structures and socialities of public health at play in India, which is the focus of my research. India's National Health Mission, which created the Asha cadre back in 2005, imagined Ashas as community health activists at a time when people-centered public health care was formally being extended to rural and peri-urban areas. Equally, however, the institutionalization of this public health system all along withheld from Ashas the absence of fixed pay, life insurance, social welfare pensions, personal protective equipment, and even symbolic status and authority. To be sure, ostensibly progressive, left-leaning public health functionaries in India often state this story, as they did to me in countless interviews. Yet their story obscures and erases a critical Ambedkarite focus on the fact that the bulk of Ashas come from the lowest rungs of India's hierarchical caste system, which ordains Dalit Bahujan bodies to intergenerational occupations of servitude, slavery, and bondage without social and political redress. Unsurprisingly then, the datafication of caste by Brahmanical public health authorities and bureaucracies in India only perpetuates casteist erasures, evasions, and elisions, and even legitimizes secular explanations for them. In other words, while Ashas are recognized by the Indian state as a public health workforce in epistemic terms, their caste identities and its associated risks and vulnerabilities are altogether erased and eclipsed from view in the state's regulative functioning. As I spend time moving with Ashas between protest sites, their homes, local health centers, public health training programs, and even on rounds among North India's urban poor during and before the pandemic, it became evident that Ashas perform for public health a vital ethnographic role as primary healthcare providers, especially for women and children, in addition to their responsibilities as frontline COVID-19 care workers. Ashas also possess key affective and embodied forms of cultural expertise based on their gendered experiences of living casted lives. As Ashas revealed to me during interviews, the latter is often more important than everyday forms of techno-scientific expertise in enabling risk communication and mobilizing empathic socialities during public health campaigns and interventions among India's most marginalized. Equally, when I visited Sunita Devi and her family in a village in Western Uttar Pradesh's Saharanpur district over the course of a few months, it became amply clear how textures and terrains of structural casteism become key to understanding how public health really functions on the ground. Sunita Devi belongs to the Yadav caste, a social group classified in the local political context as OBC or other backward classes. The Brahmins, the upper castes of her village, who till date live and conduct their everyday lives separately from the lower caste settlements, have been hostile to Sunita Devi's presence, often in explicitly vicious ways. In her early years as an Asha, Sunita Devi claims she had to face beatings at the hands of Brahmins, in whose homes she was thrust as a community health activist. A fellow Asha, she claims, was even sexually assaulted and raped. No inquiry or police case for this has ever happened, according to Sunita Devi. For her, in structural terms, not much has changed even today. And I quote, "Now the upper castes are threatening our livelihoods by staging mass refusals of vaccines, medication boycotts, and disrupting routine health checkups," unquote. For Sunita Devi and other protesting Ashas then, their caste and gender-based labor becomes the locus of each catastrophe, each vipada in their local life world. Quite to the contrary, secular and structurally naive imaginaries of global public health in India screen out the embodied vocabularies and vulnerabilities through which the interlocking fault lines of caste and gender produce distinctly unequal health outcomes. In quoting arrest, Sunita Devi and her fellow Ashas radically draw attention to the ways in which the carceral logics of casteism become welded and wielded in ostensibly progressive, pro-poor, and pro-women, albeit Brahmanical, public health policy design and praxis. For, under the banner of primary health care, nearly 1 million Dalit Bahujan women are forced to labor in a necropolitical system that refuses to name or address structural casteism as a primary determinant of unequal health outcomes. Moving then to my second vignette, which I call "When Breath Becomes Caste." I now want to turn to the story of another set of my interlocutors who also constitute an essential healthcare workforce, municipal cleaners and sweepers. I met Mangal for the first time at a low-income addiction recovery clinic near the Delhi-Uttar Pradesh border 2 years ago. At the time, Mangal was addicted to inhalants, and his complications were intriguingly framed by him as breathing ka nasha, literally an addiction to breathing. In his own terms, Mangal was addicted to the very act of breathing because he was often so short of breath. As I got to know Mangal and started spending time with him inside and outside the space of addiction recovery and his wider domestic and everyday life world, I learned that Mangal had first started using inhalants as a means of numbing his pulmonary and sensory experiences of caste. Till date, Mangal works as a contractual sweeper affiliated with a state-run institution, a hereditary occupation tied to his familial caste status. As a member of the Valmiki or the sweeper caste, Mangal's family has been engaged in the act of sweeping for over 3 generations. When he came to Delhi from a poor village in Bundelkhand 10 years ago, Mangal told me the biggest challenge he faced was going to sweep Delhi's sewers and gutters, quote, on the sly, since the caste occupation known as manual scavenging, or literally shit cleaning, has been officially declared an offense under Indian law. For Mangal, however, it wasn't the conflict with contradictions of legality that signified as much as his everyday encounter with the atmospheric discontents of the city. The early morning air pollution, the gaseous fumes from the manholes, the thickness of smog and shit, which metabolized their residues invisibly but invidiously in his body. Sometime around 2016, Mangal claims he was introduced to crude unbranded inhalants, which he started using so he could sensorially numb himself to the smells, tastes, and sights of his caste-based labor. 2 years ago, after suffering from an acute shortness of breath, Mangal was also diagnosed with recalcitrant grade tuberculosis. During the COVID-19 pandemic, municipal sweepers and sanitation workers like Mangal in large numbers have also found themselves performing emergency public health tasks like the cleaning and disposal of biomedical waste, even performing exhumations for mass burials and cremations. When I visit Mangal at his home in a Valmiki basti or a slum on the edges of the city, he brandishes a chest X-ray, which he claims is his from 2 years ago, and in Hindi he says, "Ye dekho, jootan aur jaat se phepdon ke jhanse tak," which translates to "look at this, from toxicity and caste to the wounds in my lungs." A remarkable statement that links caste pollution, air pollution, and the embodied pollution of his debilitating body and pulmonary condition into a single arc. New Delhi is routinely classed as one of the most polluted cities in the world. Yet, it's the equally real pollution of caste which pushes people like Mangal into everyday forms of toxic labor, injury, and chronic exposure to illness. When I think about the palimpsest of pollution in Delhi, Mangal's story also shows us precisely what is erased in structurally naive framings of public health involving zoonotic and atmospheric contaminants. Based on Mangal's story, I want to raise three interrelated questions. The first, why are public health guidelines and scientific advisories geared towards tackling air pollution and not caste pollution? Why do public health policies recognize the molecular realities of pollutants like PM 2.5, coronaviruses like SARS-CoV-2, but not the molecular pathways of molecular violence caused by structural casteism? And three, why do India's ostensibly universal healthcare policies, which claim to provide health insurance to the poor, fail to recognize the specific ways in which marginality and embodied inequality is constructed by structural casteism? In conclusion, through the stories of Mangal and Sunita Devi, I want to suggest, drawing on critical race scholars Chandra Ford and Collins Irene Boa, that ethnography can serve as a vital tool to shore up unmeasured and what some might consider unmeasurable socioeconomic and sociosomatic differences rooted in caste and gender inequity. Equally, to expand on what Eugene Richardson and Paul Farmer have argued, ethnography can also help to transform public health by transforming its representations, directing attention not only to transnational forms of coloniality in global health praxis, but internal forms of colonialism created and sustained by Brahmanically casteist structures, systems, and metrics. Importantly, how do Sunita Devi and Mangal's concerted centering of caste help us radically reimagine ontologies of public health in India today? What happens when the chronic forces of injury and debility emanate from an epicenter of structural casteism? What happens when our capacious analyses of slow and silent longitudinal catastrophes shore up distinctive grammars and terrains of caste beneath changing scales of time and space? And in what ways can we newly imagine what resilience, recovery, endurance, and care signify in the face of chronic health emergencies when they concentrically congeal around the fulcrum of structural casteism? As I hope to have shown, ethnography can serve as a powerful tool for engaging in a radical counter-storytelling of contagion, the etiologies of health inequity, and ensure that humanistic social justice remains vital to public health praxis. I'm going to end there, and since it's Dalit History Month in India and in other parts of the world, I also want to take this moment to recognize all my Dalit Bahujan interlocutors and their families for sharing their powerful lives and stories with me. Jai Bhim.
Thanks so much, Nikhil. Brilliant. I know we're all looking forward to asking questions and comments. We'll save those for the end, however, and we can have a discussion session after all panelists have presented. If I may then call upon and introduce our speaker, Sugandh Gupta, from the Department of Anthropology at UNC Chapel Hill. And the title of her paper is Providing Care and Mental Health Support to Essential Workers, Migrants, and Lay Individuals at Delhi, India during COVID-19.
Hi, good evening, everyone. Logging in from North Carolina right now. Can you all see the presentation? Okay, just a second. Okay. So in this presentation, I am basically going to walk you through a story with pictures and narratives of a time when COVID-19 first hit the globe. This work is it's absolutely separate from my PhD dissertation research, which is about substance abuse and mental health in Jammu and Kashmir, India. But this emerged when COVID-19 hit the globe. So when in March 2020, when lockdown was imposed in India, that time my fiance and I were both residing in New Delhi with our respective families. And it was a mere chance that both of us happened to be in Delhi. We were supposed to be in our respective fields. But as you may all recall, and I really don't know where you all were, but I'm sure it was a moment of shock. It was uncertainty, it was dread, and it was a lot of confusion as to what is really happening. And I remember waking up to that Sunday when people in the country were banging plates and utensils and go Corona, go. So witnessing all of that, I was determined to understand how to make a difference and how to contribute to this time that has befallen us suddenly. So as we were trying to wrap our heads around this new virus and lockdown conditions, it became very clear that these conditions were here to stay. And there was a way that we wanted to help and reach out to the community. My partner and I are both trained psychologists, and we were constantly witnessing, especially in the news media, stories around the pressures that the frontline workers, especially hospital staff, were going through. And in the very early days of COVID-19, when it hit India, especially Delhi, the news of Tablighi Jamaat congregation at Nizamuddin broke. This was a moment when a congregation was happening at Nizamuddin where about 9,000 people had gathered from across the globe. And because lockdown restrictions were imposed, suddenly as many as 4,000 were still there, hadn't left, had not disclosed their location, and were starting to leave, but also hiding. And when this hotspot was located of COVID-19 cases, it became a moment of panic in Delhi, especially. And Nizamuddin is located very near to where I live. So that was the moment when we decided, my partner and I, that we wanted to do something, and we decided to reach out to the local police station to see if we could provide some kind of psychological comfort, support, or listening to the police staff. While we felt that the hospital staff is battling with this invisible unknown virus, we could also hear police sirens going in, day out, and felt that police was equally exposed and baffled to the situation. This is actually the police station that's very near. And this is we approached the station house master at this police station, who was open to the idea of trying us. He was, I remember interacting with him. He's a middle-aged person, and he was like, "Why are you guys doing this? What is the purpose of it? Why do you need to be out here? Why don't you just go stay at home?" And simultaneously, his staff members were coming, panicking, explaining situation to him regarding law and order, or telling him about the latest updates around Tablighi Jamaat. And in a way, we happened to be there at those moments. And we said, "So this is how we can intervene. That we can probably just spend some time during the day, depending on the availability of your staff and personnel, and just talk to them, just listen to them, just let them vent out their fears." So after a lot of dialogue and discussion, he agreed, and he appointed us to 3 different units that were under his care. And we were going to visit them thrice a week and interact with the staff there. These interactions revealed to us the fears, uncertainties, and anxieties that the police staff carried as they reported to work every day. We interacted with men and women both. They expressed fear around contracting the virus, difficulty reaching home because of the shutdown of public transportation, safety of their loved ones at home, especially because they were stepping out every day, not being able to avail any kind of holiday because of indefinite suspension, and a sense of dread, especially in the initial days when PPEs, gloves, and sanitizers were slow to come. Moreover, these police personnel were also involved in identifying and tracing Tablighi Jamaat people, and it was difficult for them to identify people who had fled. Once these people were identified and located, they also had to convince them to get tested. They had to understand and explain the testing process, something that was very confusing and challenging for police personnel themselves, because there wasn't very coherent information, if I may say so. And while performing these new tasks, they also told us that they had to ensure that lockdown restrictions were being followed, they were being respected, they had to maintain law and order, and not really surprisingly, and also attend to a lot of domestic abuse calls, something that the police personnel told us had increased remarkably when the countdown started. So while we continued working with the police, a new crisis was simultaneously emerging, which was in the form of migrant workers. These were people who could not go home because of lack of public transport, and they were walking along the streets, roads, alleys, and highways. And I quote police personnel telling us that we are picking these people and we are sending them to shelter homes. And shelter homes here refers to basically government schools and facilities where classrooms had been converted into makeshift rooms for the migrant workers and their families to rest. Anger, rage, disappointment, confusion tend to occupy these spaces. The police personnel asked us that, while we've been talking to their staff members, if we could start doing some interactive sessions with these migrant workers so they could get some assurance, because every time the police personnel would walk in to check in on, we visited 5 facilities, and on an average, 200 to 250 people were put up in every facility. And every time the police would walk in every day to do their rounds and checks, they would face a lot of screaming, they would face a lot of questioning. So they were like, maybe you guys as outsiders and strangers could come here and talk to them and assure them. And in this image, I'm actually talking to a pregnant woman who was discussing and sharing her prenatal needs with me. And I was trying to understand how to best help her. And fortunately, AIMS and IBHAS had started services to provide basic medical needs and basic medical supplies to these shelter homes. So every week, IBHAS personnel would come and somebody from AIMS would come to check up with these people to understand what are the medicines that they've been taking. The prescriptions were slow to arrive, to be honest, but there was an intention and there was some activity that was still happening. Interacting with migrant workers was one of our most painful moments because we met people of varying age groups who only had one question for us. When can I return home? How can I speak to my loved ones? When will the buses or trains start running? These people were residing in bare minimum conditions. There was no access to television or newspaper. Some of them had smartphones, so they could access news and they could access media, or they were basically talking to us and asking us to tell them what is happening in the outside world. The police personnel tried to engage them by basically giving them tasks around the school building, which in one way or the other was basically an exploitation of their time and talent. So we saw migrant workers painting the school building, painting the pots and plants, cleaning the washroom, cleaning the yard, painting the gates, in a way to keep them busy, but also in a way to extract labor. As our work with police and migrant workers gained momentum, we noticed a need to do something on a daily basis. And that is how the idea of chai seva or chai langar came to be. As you know, most Indians love their chai. And when talking with workers, we realized how much they missed it daily. The government had been sending food twice a day, but often it won't be sufficient. And the food timings were really awkward. Like they would come either at noon or 3 p.m. or 8 p.m. So there was never a fixed time when the food would arrive. So we also tried to supply some food to these shelter homes, but chai langar became one of our daily tasks. So fortunately, we were able to do chai langar because we had a shop underneath my partner's house that was a restaurant before lockdown. So we had all the gears with us. And my brother, my partner, and I, we basically converted that space to make chai. And every day for a month and a half, we made chai for about 400 to 500 people. So we sought permission from the police. We maintained social distancing and served chai to essential workers who were on road every day, sometimes bearing the brunt this is, sorry, just some images from that time. So we provided chai to essential workers, which included e-commerce service delivery people, some rickshaw pullers who were on the road, rat pickers, domestic help, fruits and vegetable sellers. And we identified that there were people who were still unable to go home, who were hiding and living in the streets and would come out for some time during the day. And as we befriended these people and served them chai for a month and a half until the local chai vendors opened up. So this period of chai langar was fascinating for two reasons, because one, this was also the time of Ramzan, partially it coincided with the time of Ramzan. And the Tablighi Jamaat case was also very recent at that time. It was still ongoing. And Nizamuddin, along with, if you're familiar with Delhi, so Jamia is a place where there's a lot of street food and Sahari and Iftari happens. And same way, Nizamuddin also caters to a lot of Muslim population. And a lot of food is cooked there from where it is outsourced and distributed to low income housing. And at that time, Nizamuddin had been declared a no entry zone because of the Tablighi Jamaat case. But in the migrant shelters, a lot of people were following Ramzan, and a lot of people were struggling to get their daily sahari because of delays in the food delivery system by the Delhi government. So at that time, we were able to pitch in and we were able to collaborate with some people in Nizamuddin. And my partner took on the responsibility to supply food to different migrant shelters that we had been going to. And we supplied them with sahari every day. And also during this time, as we were doing chai langar, we were also trying to substitute this chai langar with some biscuits. And in order to find something more affordable, we reached out to just a random person. Like there was a phone number on the biscuit packets. We were calling them and asking them that if we want to pick up in bulk, what would be your wholesale price? And in one of these random conversations, we connected with someone called Abdulji. Abdulji lives at Jamia, and he heard our story. He heard what we were doing, and he said, "Okay, let me come one day and see what you do." So the next day afternoon, he arrives and he saw us that we were preparing chai, and he basically left what you see, packets of rusk. I don't know the English translation for it, I'm sorry. But he basically came, and in the entire duration, he donated us 150 kgs of rusk, and he refused to take any money from us. And he was just like, this is my little seva in what you are doing. So to conclude, my intention to share this firsthand experience with all of you is to highlight the everyday practices of care that got forged during the COVID-19 period. It became a moment of social rupture and revelation as we improvised the social, psychological, and economic resources and fostered new networks of care across class and religion in an increasingly divided India to address the unfolding crisis when the world went into a sudden lockdown. In this work, I could see how everyday practices of care had moral, practical, and political complexities. We were constantly navigating police personnel, medical personnel, our personal and familiar lives, and the invisible virus threatening all of us at every step of the way. I also recognized that care can coexist with harm, and it can simultaneously be compassionate, violent, and isolating. So while the government was thinking that they're trying to protect migrant workers by pulling them off the streets, by picking them off the streets, if I may say so, and putting them at these government shelters, we also saw how these shelters were becoming sites of isolation and pain. So to conclude, instead of taking sides, I just want to encourage us to think about and make connections and critically examine the potentiality of care in a world where questions of health, medicine, religion, everyday life, and dignity are in a constant flux now. I just hope that this presentation helps us to spark some of those conversations. Thank you so much.
Thank you so much. We really appreciate your insights on these new networks of care. I hope we get to talk more about them at the end here. Next, I'd like to welcome Logan Emlet from the Yale School of Environment. And the title of Logan's talk is Food Systems and Disconnections During a Pandemic in Dolpo.
Hi, everyone. Can you see my slides? Okay, wonderful. Well, I want to start just by saying thank you to everyone, to Jan and to Anna and everyone either at UH or virtually at UH who's made this symposium possible. And also to my co-panelists, I'm really grateful to have the opportunity to listen to your work and learn from it, and also to share some of my own. So without further ado, I'm going to start with a story as well. On August 31st, 2020, Dolpo Budagam sent a formal petition to the federal government of Nepal. It warned of famine and requested the immediate delivery by helicopter, if necessary, of subsidized food. An annual consignment of rice had been waylaid by the coronavirus-induced closure of the northern border. But in fact, shipments hadn't come to Food Management and Trading Corporation depots in the upper part of Dolpa district in northwestern Nepal for 2 years. And 6 more months would pass before government rice began to arrive by mule train from the district center, 2,000 meters lower and a 3-day walk to the south. Even so, famine did not materialize in this area that is routinely characterized as chronically food insecure. The local government stepped in to provide 100 kilos of maida per household at a 50% subsidy, and local charities stepped up too. But these kind of piecemeal interventions alone can't explain how people adapted to food system perturbations brought about by the pandemic and the pandemic response. And in this talk, I'm going to kind of examine this quandary by situating the pandemic's implications for local food systems in ways that Dolpopa have navigated perturbations within longer histories of food system precarity. I do so in 3 stages. First, I look at the pandemic's implications for local food production, market and non-market based food systems, inter and intra-regional exchange and consumption patterns. Second, I suggest that pandemic-related disconnectivities are prefigured by others. Especially, I highlight the 1960 birth of the border, but by implication also things like the decade-long Civil War, the 2015 earthquake, and subsequent political restructuring. I show that pandemic responses replicate, contest, and rework food-related uncertainties. And finally, I outline forms of anticipation that the coronavirus elicits, futures that people seek to enact with the social and economic materials that emerge in its wake. And these are stories about food, and of course, around food, care sometimes congeals. And so these stories about food systems are fundamentally also stories about networks of care that are selective and involved in expansive and historically deep political systems to which both of my co-panelists have spoken in different ways. Before I get started, or before I go further, I just wanted to talk about how this research was conducted. I am talking in this presentation about the experience of communities with whom I've been involved since 2018, 2019. This research has been conducted remotely by extensive reading of the news, of social media, and of interviews with a few kind friends and colleagues with whom I worked in a mutual aid project for Dolpopa living in Kathmandu during especially the second wave about a year ago this month. And so I don't have photos of my own, and instead I am taking this opportunity to kind of highlight some really wonderful Dolpopa artists and their work, and the kind of expressive games that they play with time, fusing histories and futures in various presents. So Karnali's history as a district or as a region has long been synonymous with food insecurity. And this history is bound up with, although its telling frequently obfuscates, food systems that are shaped by uneven hierarchical relations of connectivity and disconnectivity. that is, autonomies and dependencies in tension. People in Karnali tend to grow food on their land and trade for or buy food that is grown by their neighbors, either in the next valley, in the Tarai, or further afield. And I wouldn't read too much into this map, but this is just a kind of graphic representation of how scarcity and sort of development and quote unquote backwardsness is visually portrayed in some kind of prominent media. In Dolpo, where the climate affords a single growing season per year, most households produce between 4 and 6 months of their annual requirements from their own land. The past 70 years have witnessed a sea change in where the remainder of the year's sustenance is sourced. A food system based on the grain salt trade, in which Dolpopa cyclically and profitably exchange salt harvested by their northerly neighboring Drokpa for grains grown by Mumpa denizens of the hills to the south and vice versa, has transformed into a cash-based commodity system where money, much of which comes from the harvest and sale of Yortsagumbu caterpillar fungus, buys rice, flour, and other processed goods, the vast majority of which are produced thousands of miles away in eastern China. In frank response to a journalist's question about the shipment of maida, a man stated, quote, "We pick Yortsagumbu to buy rice and eat. This year, the coronavirus wouldn't let us harvest Yortsa. So in circumstances like these, it's nice that the government helps," end quote. This is a stark contrast to the food system based on agropastoral trading of yesteryear, which was largely outside of state control, which prioritized non-monetized forms of exchange and in which rice was a rarity. But while this Yartsa Picker's statement is a much needed reminder that Dolpo is not, nor has it ever been, the unchained Shangri-La found in trekking company brochures, it obfuscates the extent to which barley cultivation and caring for the quadrupeds who make it and so much else possible in these landscapes possible. It also resonates with a statement from livelihood and food security researchers at ISIMOT, who observed that, quote, "The pandemic has impacted entire food systems in the Hindu Kush Himalayan region by disrupting agricultural production activities, food supply chains, and trade." In what follows, I aim to understand the extent to which this claim is true of Dolpopa food systems, which are composed of part local production and part market purchase. So the World Health Organization declared coronavirus a global pandemic on the 11th of March, 2020, and Nepal's countrywide lockdown, the observation, enforcement, and particulars of which varied widely, came into effect 13 days later. This coincided with the beginning of the annual agricultural calendar in Dolpo. Between mid-March and mid-April, work in which user groups repair irrigation canals, transport manure to fields, irrigate, and sow, brings people together through labor exchange, called lakpo, or requires households to hire on extra labor. According to one interlocutor, these forms of labor, which are central to preparing fields in the short planting window, are potential vectors for viral transmission. But even so, communal work appears to have continued apace, perhaps because Dolpo's relative inaccessibility was widely presumed to isolate it from the virus, or perhaps for lack of an alternative. In Dolpo, seeds are mostly saved, but other inputs, namely urea, are purchased annually from the seasonal market in Tibet. Border closure in 2020 made access to fertilizers difficult and expensive in the next year. Whether sourced from Jomsom or Dunai, additional transport costs result in a net cost several times higher than if procured from Tibet. And though as yet unreported, sudden and drastic reduction in soil amendments may yet curtail yields and reduce the capacity of households to rely on their own produce. Thus far, however, overall agricultural production and productivity in Dolpo appears to have been little affected by the pandemic. Even if records of local production were available, which they're not, it would be difficult to differentiate pandemic effects from other perturbations. In 2020, for example, farmers in Dolpo Budagampalika also experienced locusts and unseasonable hail. And though reportage on food shortage and the government's slow distribution of subsidized food is abundant, pandemic-related irregularities in local and regional agricultural production don't feature as common explanations. However, when it comes to market-based ways of accessing food, the story is very different. The pandemic made it more difficult for people to make money and to spend it. Response measures, which included a ban on harvesting Yartsagumbu throughout the 2020 season, limitations on harvest in 2021, and the closure of the northern border since the beginning of the pandemic, have seriously constrained Dolpopa engagements in cash economies. These pandemic-related barriers join pre-existing causes of perturbation. Indeed, as Dolpo scholar Forwadandup notes, the history of the harvest is the history of struggle for rights to access and to govern access to Yortugumbu and its profits. Alternative sources of cash income, for example, hosting tourists, researchers, and salaried government employees, were also disrupted by the pandemic. Further, market-based food systems have been refigured by disconnection from the seasonal fare over the border in Tibet, which is people's main chance to sell and purchase goods. This has resulted in a reversal of the orientation in the geography of exchange. After years of looking north for markets, the pandemic response has forced people to search south. And given the border closure, quote, most people are forced to buy from the lower part of Dolpo or from Nepalganj. The price that Dolpo pay for this shift in markets is quite literal. Goods often cost 2 or 3 times what they would cost on the northern border. The trade to and from the south is generally controlled by southerners or people from lower Dolpo and further afield, which means that any windfall from the reorientation of Dolpo trade relations accrues to non-Dolpo. In this corner of Nepal, as elsewhere, already marginalized people pay the price of incorporation into national markets, strengthening the hold of established traders on circuits of exchange. That Dolpo have fended off famine for a year despite drastically reduced incomes and increased prices, and while government subsidized food has failed to materialize, indicates the existence of alternative means of procuring food and other necessities. And it's to those I now turn. Lockdowns, which have made extensive exchange sporadic, have encouraged people to turn inwards. Intra-regional, non-monetized, inter-household exchange within and across villages in Dolpo has continued and has likely proved central to people's food-getting strategies during the pandemic. This exchange may take the form of a loan of food, generally barley, the value of which should be returned later on. Another short-term strategy involves work or milak for a wage paid in food. People may also form a portion of another's household land for generally half of the crop in return. While I wasn't able to get a great sense for the particularities and the extent to which these practices expanded or how they coalesced in consumption patterns, my interlocutors unanimously suggested that local production of especially tsampa, or roasted barley, filled in for lost access to rice. From here, I want to turn to discuss histories of disconnections. The pandemic response tends to take the form of a blockage, as we've all kind of experienced. It seeks to isolate, to separate, and create distance between. A peripherality, like remoteness, is produced and relational. But how do people envision, enforce, and experience pandemic-related attempts to isolate, separate, and distance regions or in regions that are widely considered archetypes of isolation, separation, and remoteness? In other words, how do you separate something that's already separate? Karnali in general, and Dolpo in particular, are always, or in particular, have long been represented as amongst the most isolated, poor, and quote-unquote backwards places in Nepal. And these discourses contour pandemic encounters, as typified in the words of a tween operator from Mugu, when he said, "Corona le Karnali katna sakena," or "Corona can't cross Karnali." Maintaining our focus on food systems enables us to discern trends, patterns, and breaks in Dolpo relations stretching beyond Dolpo, characterized at different times by and strategically as dependence, interdependence, and independence. Out of much longer pasts of disconnectivity in the region, the territorialization of Nepal's northern border post-Chinese occupation of Tibet in 1959 is perhaps the most similar historical precedent for the experience of pandemic-related immobility in Dolpo. Like pandemic-related lockdowns and border closure, the interruption of north-facing socio-ecological relations in 1959 was an event of profound disconnection, severing ties through which people laboriously reproduce local food systems and lifeways. Both this and the pandemic response resulted from government decisions made by bureaucrats acting hundreds of thousands of miles away, and in both cases, each valley's response has differed. Of course, the kinds of relations interrupted in each case are radically different, but then as now, rupture redirected relations of interdependence, or channeling Kyle White, well-established indigenous traditions of mobility respond creatively in new conjunctures. Scholars of pastoralism tell us that mobility, or the capacity to reestablish relations elsewhere, is often leveraged in the face of political and ecological perturbation and uncertainty by pastoralists the world over. In the 60s and 70s, Dolpo worked individually or in small groups to build up relationships with neighbors to the south and west. In the wake of the pandemic, members of municipal governments have agitated for timely federal relief, charitable organizations have stepped into the gap, and Dolpo have been forced to pay the price in cash for dependence on commercial networks dominated by Southerners. As the difference between these forms of mobility indicates, the capacity of Dolpo to reestablish relations elsewhere has changed in fundamental ways in the intervening years. This capacity is not linear and emerges through processes of non-post-colonial state formation in both Nepal and China. Since 1959, new regulatory regimes such as the designation of Dolpo as a restricted area in 1970, the takeoff and expansion of community forestry programs after 78, the establishment of Hye Phok Sum Do National Park in 1984, have all curtailed Dolpo mobilities and impinged on their interdependencies, exacerbating food insecurity, driving out migration, and leading to bloodshed over access to natural resources like Yartsa Gumbu. More recently, on the other hand, Dolpo have used formal education, telecommunications, and political restructuring to create new forms of connectivity, which leads me to the next point. Histories of mobilities and interdependencies inform the pandemic conjuncture and implications for Dolpo food systems, but they also inform how the pandemic figures into and reworks people's future plans and aspirations. The horizons of possibility that present themselves to people and communities are shaped by experiences of disease and response, lives lost and livelihood strategies undermined, relationships forged and experiences gained. What aspirations emerge from the social and material conditions of the pandemic in Dolpo? What futures do people seek to enact with the social and economic materials available in its wake? As has been the case the world over, the pandemic has shown people in Dolpo the fragility of productive systems that make life possible and the stubborn tenacity of the political orders that prop up those shambling systems. At all scales, people are thinking about what underwrote the precarity catalyzed by the pandemic and planning for an uncertain future. One common inclination is an aspiration for increased self-reliance and independence on household and community levels. The expanded role that locally produced staples like barley have played in consumption patterns indicates one possible shift. According to one interlocutor, quote, "The pandemic has suggested new ways to live and given space to think of alternatives. And it has suggested that we do something with what is already here, what can be produced and cultivated on our own land." A countervailing theme is an aspiration for increased connection, interdependence with and/or dependence on extra-regional networks and commodity systems. During the case surge of the second wave, relatively new and often under-resourced decentralized government structures made it difficult for local leaders to source emergency supplies. According to another interlocutor, going forward, quote, "There should be good connections between local people and the responsible authorities, for example, at the district health office and at the federal level. These kinds of connections should be built up to ease supply issues during a pandemic." So we have contrary aspirations for both self-reliance and greater connection, and these constitute a productive contradiction, I think. Though it remains to be seen how these dialectics of dependence will unfold going forward, the pandemic has provided new memories, experiences, and discursive tools like Rahat, which we can talk about later, with which people are reworking relations, including those that organize food provisioning at a number of different scales. And it will be instructive to observe people's decisions in the coming years regarding land use, livelihood strategy, and the allocation of labor. For example, will people endeavor to increase the intensity of agricultural production? Will people look to expand herd sizes? Will Dolpo traders and business people attempt to increase their share in supply chains that connect Dolpo and the lower hills? And how will local governments navigate people's simultaneous aspirations for increased self-reliance and interconnection? In conclusion, I want to explore a provisional response to this final question in the form of a memorandum shown here also to the federal government, also from local leaders, delivered a year later in August 2021. It plots a path towards local self-determination in which Dolpo are responsible for providing government services in their own language, making their own land and resource use decisions, and governing their own development activities. The claimants aim to do so by expanding infrastructural connectivity, the physical manifestation of the state in the form of government offices and roads, or what Fiona Wilson has called stretched out spaces of social relations. Parts of this call find resonance in planning approaches espoused across Nepal's Western mountain districts, where infrastructures expand and extend by way of neoliberal forms of contract governance. Yet, Infrastructural connectivity is here invoked as part of a call for restructuring regional governance to enable self-determination. Insofar as infrastructural liberalism has been shown to be anathema to self-determination and to concentrate extant state and market hierarchies, what are we to make of this contradiction? I want to suggest that the memorandum be understood as a form of pandemic response. It emerges in the wake of the pandemic into a political context fundamentally shaped by 2 years of pandemic-related political turmoil, and builds on the pandemic experiences of local representatives. Like the infrastructures these requests may precipitate, pandemic responses are totally fraught in that they fracture as much as they connect, frequently in unintended ways. The memorandum's requests, if acceded to, would have disconnective results. But unlike other recent policies targeting Nepal's Western mountains, and unlike the pandemic response writ large, the memorandum is put forward by Dolpo for Dolpo, and therefore constitutes a bid for what Dinesh Paudel and Catherine Rankin have called relational autonomy, or an attempt to control the terms of disconnection within and beyond the region. Therein, perhaps, lies some hope. So thank you. And those are some pictures from some of the mutual aid work and other charity work that happened right at the height of the second wave.
Thank you, Logan. Thank you for the artwork as well. A nice addition. Next, we have Khushee Doshi from the University of South Florida joining us, and she'll be presenting Exploring the Impact of the COVID-19 Pandemic in India through the lens of gender and vulnerability within the domestic and social sphere.
Good morning, good evening, everybody, depending on what location you're at. I will share my screen. Are you able to see my screen? Okay, thank you. So this is a research project that I did for my University of South Florida honors thesis with my research mentor, Dr. Singh. And as the pandemic unfolded globally, there were a myriad of different disparities that unfolded simultaneously. Some were obscure while others were more prominent. And one of the more obscure inequities that unfolded was the shadow pandemic, or the pandemic that related to domestic violence and intimate partner abuse. And as the pandemic unfolded, the shadow pandemic and the plight of women globally exacerbated. And my research particularly sheds light on how the pandemic induced social mobility, poverty, and economic uncertainty due to the series of lockdowns that took place in India. And the social immobility, poverty, and economic uncertainty particularly intertwined with the rooted patriarchal framework of India's social dynamics caused a galvanized domestic abuse in India, particularly within the rural communities. And it thrusted women into this state of uncertainty, and it amplified their predicaments. Now, within India, domesticity and domestic responsibilities have long been associated with women, particularly due to the strongly rooted patriarchal framework. And as you can look at figure 1, the United Women's study from 2015 to 2016 demonstrated that South Asia was leading with the number of women that were employed within the informal economic sectors. And oftentimes women within the informal economic sectors were employed as street vendors or domestic workers within households. And the reason behind women's predominant employment within the informal economic sector in India is due to their long confinement to domestic duties and majorly women from conservative backgrounds were prevented from navigating the social and financial realm and becoming financially independent. And this suppressed them from gaining those skills and the educational qualifications that they would require in order to enter the formal economic sectors. And as time progressed, there was an increased need for women to take up household responsibilities and contribute financially due to the expanding economy of India. And in India, which is why they would have to turn to the informal economic sector and try to work as domestic workers or street vendors or subsistence farmers. And in India, 60% of women aged 15 to 59 are engaged in full-time domestic jobs, and 90% of the women are employed within the informal sector. And when these women are employed within the informal sector, there's a lot of instability, and they are at a predominant disadvantage when compared to their male counterparts because they're deprived of essential social services and oftentimes have a very lagging role in the realms of health, politics, as well as the overall economy. And there's also a mass expulsion of informal labor during the onset of the pandemic because of the lockdowns and the limited mobility socially as well as within the economic sector. And that caused women to be confined back to their homes, and then they were thrusted with those domestic duties. So it was a backward trend. And it also contributed to it placed an expanded risk on the women for being susceptible to being the victims of domestic abuse. And turning to the plight of young girls, the entire shadow pandemic and the side effects of the lockdowns induced by the pandemics also seeped into young girls because the closure of schools, particularly within rural areas, and the inaccessibility to online education within households that were from a lower socioeconomic status caused young girls to drop out of school, to take up domestic responsibilities. And oftentimes the financial situation and the financial state of a household would force these young girls into child marriages, teen pregnancies, and an increased filling of domestic duties. Now, children were also bearing the brunt of India's pandemic, as well as the lockdown that was placed as a result of the increasing COVID-19 cases. And the lockdown certainly plummeted the economy, and there was a stagger mortality due to the virus. And these were the two prevailing factors of the pandemic that disproportionately impacted young children. And the economic slowdown particularly contributed to financial hardships faced within India's most hard-hit households. And that forced children to migrate to cities and places with more economic opportunities in search of labor work, particularly as child laborers. And these children who would migrate to cities in search of work were deprived of a formal education and would face a staggeringly high risk of being susceptible to sexual abuse as well as trauma. And during the pandemic, the lockdown, the childcare services were severely disabled, and there was also dwindling access to child trauma services. And that further instigated the suffering of these young children. And everything that children had to endure, from being orphaned to entering the child labor workforce, was also second-handedly experiencing household domestic abuse or being direct victims of domestic abuse or abusing in general, they were at a heightened risk of physical and sexual abuse, and all these factors intertwined and translated into an impeding psychosocial development of these children, because they were at a higher risk of suffering from post-traumatic stress disorder, anxiety, depression, and overall it just galvanized a vulnerability crisis, not only for the women, but for the children of India during the pandemic. There were several surveys that were conducted to understand and gain an understanding of how the experiences and predicaments of women were exacerbated due to the onset of the pandemic. And migrant workers were at the heart of all of the predicaments that came across as a result of the COVID-19 pandemic. And most of the migrant workers in India are concentrated within the northern states, as you can see in figure 2, of Uttar Pradesh, Bihar, West Bengal, as well as the national capital of India, which is Delhi. And there were qualitative surveys that were conducted in the slum areas of Haryana, which is a northern Indian state, and Delhi, the capital of India. And the migrant workers revealed that they had high instability due to the pandemic. There were financial restraints that were placed upon them, and that caused women to experience poor nutrition and an inaccess to feminine hygiene products. The lockdown also restrained access to essential services like medical services, and a lot of households were deprived of clean access to toilets. Also, there was a survey conducted of about 200 married women in rural Kerala, which is a southern state in India. And they described their plight by demonstrating how they were suffering a rampant suppression and a lack of social mobility, and that the lockdown also caused them to be more financially dependent on their abusers, which would largely be their husbands and the men of the household. And there was a controlling behavior that caused and galvanized their plight. Also, as you can see, figure 3 and 4 represent how the controlling behavior, as well as unemployment and the unavailability of alcohol, triggered aggression within men and made them more susceptible to translating that aggression to the women of the household. And figure 4 also portrays how these women, because outreach services were dwindling and they didn't have access to social services around them, there was an underreporting of these cases related to domestic violence. Now, a large part of why there is an underreporting in cases and why this discussion around domestic violence is so in the shadows is because of the digital divide in India. And when we think about digital divide, it's not only within the rural and urban areas. Of course, there is a conspicuous divide within the rural and urban areas, with the urban areas having a higher access to internet services, mobile services, and the advancements in technology. But there's also a gendered perspective to this digital divide. And during the pandemic, many interventions were taken at the state level by governments and state governments to help combat the rampant domestic abuse crisis. But all of this was in the form of helplines and telecounseling and driving social media campaigns. And oftentimes in rural contexts, women wouldn't have access to social services or internet networks or phones that would help them join the conversation or report their plight. And they're 26% less likely to use mobiles and 56% less likely to use internet services when compared to men. And this prominent digital divide, especially when combined with that gendered perspective, caused a severe underreporting in cases relating to either dowry, intimate partner violence, or domestic abuse. Now, India, the women within rural contexts were at an intersection of social standing as well as gender. And women of lower caste particularly stood at those intersections because they were excluded. And as I previously mentioned, a lot of these women were within the informal economic sector, so they worked as domestic workers. And upon the onset of the lockdowns, there was a mass expulsion of these women and domestic workers, which caused that, and that was particularly because of them being labeled and viewed through an eyes of immense stigma. These women of lower castes were often labeled as the carriers of the COVID virus. And that is why there was fear within the upper class households, which eventually led them to conduct this mass expulsion of domestic workers because of that stigma that was associated with women of lower caste. And there was also a societal frustration within the migrant men because they were also removed from their jobs because of the pandemic and the slowing down economy. And the aggression that built within them was eventually translated to demonstrating through violating women within their households. And overall, when these women were thrusted back into their households with increasing social immobility, they were at a high risk of being deprived of social essential services like financial independence, health services, as well as proper nutrition because of the inaccess and inadequate access to food. And these figures demonstrate the MSSK, which is a social service organization, and it stands for Mahila Suraksha Evam Salah Kendra. So this is a social service organization located in Alwar, which is within the state of Rajasthan. And there was a telephonic survey that was conducted during the pandemic with 36 women who faced domestic violence. And figure 5 shows a group counseling session. So one of the officials from the organization would speak to the couple regarding domestic abuse or instability within the household, as well as certain inequities that the women face. And there would be a sort of intention to resolve these issues on a household level. And the women who were surveyed through the telephonic interviews revealed that the major source of social support prior to the pandemic was through conversations and discussions of the predicaments they faced, such as domestic violence or harassment for dowry. And they would discuss those problems with their natal families, so their mothers and the mother side of the family, and that would give them some sort of social support. However, the pandemic thrusted everyone and confined everyone to their households, and oftentimes the controlling behavior of their abusers would prevent them from reaching out to their family and to discuss what they were going through, and it also increased the risk of them suffering and their role as victims. So that was a major impediment for these women to get the social support that they most needed. And additionally, MSSK played a huge role as they tried navigating through the lockdowns as well as the pandemic to develop social services that would help women. What they did was they offered support, particularly appraisal support, through conducting sessions with groups of women who had been going through the same domestic violence and abuse. And they would facilitate these women to connect with other women going through the same thing and discuss their plight. And that would help them obtain a sense of security and emotional satisfaction. And that would make them more open towards the discussion of their problems and discussion surrounding domestic abuse. And it would also help towards destigmatizing this topic. Now, media has played a very essential role in the shadow pandemic and putting it out to the table and facilitating the conversation surrounding domestic abuse, particularly social media. And the government of India instigated, well, because of the diminishing social support systems, it was hard to emerge out of the abuse successfully for women. So there were three newspapers that were the Hindu, Dainik Bhaskar, and the Times of India, who conducted a study, and they demonstrated how the number of cases from March to July of 2020 correlated with the peak of the lockdown. So as the peak increased, the number of cases that were reported also increased. And one important aspect is the availability of alcohol. So somewhere around the months of May to July of 2020, alcohol shops began opening, and there was the access to alcohol and the abuse of alcohol, and that was combined with the lack of productivity, particularly for men, and that caused them to demonstrate an increased aggression towards the women or the women of the household. Now, Sneha NGO is a non-governmental organization in Mumbai, India, and what they did was, during the peak of the pandemic, they facilitated this hashtag activism called Lockdown Mein Lock Up. So what they did is that they listed names of domestic abuse victims that they would personally work with on their Instagram page, and this basically was intended to combine and to encourage celebrities in India to join the campaign through taking up the name of one woman, sharing their picture, sharing the story of that woman. So the main motto was to give a face and to give a real story to the women who were suffering domestic abuse. And there were several Instagram pages that would create these little videos that would enact what a woman would go through during her experience as a domestic abuse and a victim of violence. And it was to serve as a boon to bringing the issue of the shadow pandemic and to shedding a light on the victims that were going through this predicament. So in a time of adversity, this campaign against domestic violence was almost like solidarity, and it really helped bring about a conversation and to shed light on this much needed topic that needed to be talked about more and more as the severity of the pandemic and the severity of the shadow pandemic increased. Another major role that the regional media has played a huge role in portraying individual cases of women. And Khabar Lahariya is a newspaper that's based within rural localities of India. And what it does is it covers individual women's stories. And they had played a huge role during the pandemic to cover dowry cases, domestic violence, intimate partner cases. And there were two cases particularly of women within Madhya Pradesh, which is in central India, and Uttar Pradesh. And two women were focused in Mahoba, Uttar Pradesh. There was a 23-year-old woman, which is on figure 11. She faced severe physical and verbal abuse from her in-laws over dowry for over 5 months during the pandemic. And they were asking for about 200,000 in dowry from her, and they're also asking for jewelry. And her inability to submit to those demands of her in-laws led the in-laws to not only abuse her but also her family members. And she also filed complaints to her local police stations, but because of the police's occupancy with other pandemic-related restrictions, they never paid enough heed to her case. And also in figure 10, it shows a woman in Chitrakoot, Madhya Pradesh, and she was harassed by her in-laws again for dowry. They were asking up to 600,000 in dowry, and they actually hit her with stones and bricks, and she was severely hurt. She faced a lot of injuries to her head, and they also restrained her from using the restroom until she submitted the money in dowry. So Khabar Lahari and regional media particularly, what they did, they played a huge role in shedding light on the case of dowry, which is highly overlooked in India. And particularly it gave a lens, and it gave a vision to that of the rural communities who were often overlooked by national media or international media. So regional media evolved and emerged to be a huge voice for these women. And lastly,
I'm sorry, I'm so sorry to interrupt. We are
Yeah.
out of time. May I ask you to wrap up with some conclusions?
yes, so
Thank
I will be ending now. But
Perfect.
as I just in the conclusion, I wanted to portray that the plight of women translates not only domestic abuse and intimate partner violence is not only hurtful to their physical entities, but also translates to their psychological and mental sphere, as many women are at higher risk of PTSD, depression, anxiety, as well as poor nutrition because of these problems that are inflicted upon them. And that will be all for me. These are my references.
Thank you so much, and apologies for interrupting when you were so close to the end.
Thank you, and I apologize for going over time.
So at this point, I would love to hear from our attendees.